Okay, so pharmacological actions of salicylic acid derivative. So in that you are going to have salicylate like methyl salicylate, then sodium salicylate, acetyl salicylic acid, and diflunisal. Diflunisal. Yeah, we call it diflunisal. So acetyl salicylic acid is known as aspirin. So what is the actions of these drugs on your body? So locally, methyl salicylate. It is an irritant, counter irritant, then keratolytic, and it also have antiseptic and fungistatic actions. Okay. So irritant or counter irritant means they will reflexly decrease the pain by causing the inflammation. ठीक है, ये थोड़ा सा कॉन्ट्राडिक्टरी होता है लेकिन वो करते हैं. they they causes the irritation to your joints and all that, and they decreases the pain. Okay, keratolytic means they break down the keratin. So you might have seen आपको कोई मस्सा आ गया या फिर आपके पाँव में बहुत बड़ा ऐसा there is a tissue development that is known as a that can be removed by acetylsalicylic acid. कॉर्न बोलते हैं उसको. कॉर्न आपके पैर में कोई कॉर्न डेवलप होगा तो कॉर्न कैप नाम का एक एडहेसिव प्लास्टर आता है, कॉर्न कैप नाम का. दैट यू हैव टू अप्लाई ऑन दैट डेवलप्ड कॉर्न and that can be removed by salicylates. So keratolytic, it will break down the keratin. They are also antiseptic and they also have fungistatic action. They will also stop the growth of fungus. Locally, when they are applied, they act as a counter irritant, keratolytic, antiseptic, fungistatic action. Now, on the CNS, what is the action first? Analgesic. How they will decrease the pain? Codeine and aspirin, they are combined together for the synergistic effect. कोडिन के साथ में एस्पिरिन देते हैं जो वो सिनर्जिस्टिक इफेक्ट दिखाता है. कोडिन एंड एस्पिरिन कैन बी कंबाइंड विद द टुगेदर टू गेट अ सिनर्जिस्टिक इफेक्ट. एस्पिरिन क्या करता है, मैकेनिज्म देखो एस्पिरिन. इट इज इरिवर्सिबली inhibit the synthesis of prostaglandin by inactivation of COX. So it is irreversible inhibitor of COX. Question इसके ऊपर आ चुका है. Which drug is an irreversible inhibitor? So only aspirin and phenylbutazone. They are the irreversible inhibitor. Rest of all are the reversible inhibitor. Aspirin क्या है, अकेला खतरनाक है, irreversibly inhibit करता है. क्वेश्चन आ चुका है इसका. Irreversible inhibitor of COX. Okay, and other NSAIDs are reversible inhibitor. It may difference. So mainly it is used for dull type of or itching pain, throbbing pain, low intensity pain arising from muscle and joint. ठीक है, थोड़ा सा कम पेन है ऊपर का तो ठीक है, इट्स ओके. डिस्मेनोरिया एंड टूथएक. सो इट कैन रिलीव द पेन ड्यू टू टूथएक. दांत दुखता है तुमचा, दांत में दर्द है, पेन रिमूव होगा. जॉइंट से थोड़ा बहुत पेन आ रहा है लो इंटेंसिटी का, कम हो रहा है. So if you are getting deep pain, visceral pain, so deep pain and visceral pain will not be relieved by aspirin. Aspirin deep pain नहीं कम करेगा, visceral pain नहीं. So it only relieves the dull itching type throbbing pain of low intensity arising from muscle and joint. Dysmenorrhea and toothache. Antipyretic action. Antipyretic action. So in case of fever, in case of pyrexia, pyrexia में क्या होता है, your thermostat mechanism is set to the higher level. आपका thermostat mechanism जो होता है वो higher level में set किया जाता है. कौन set करता है, hypothalamus. Okay, so in the fever or in the pyrexia, thermostatic mechanism is set to a higher level. Now salicylates, they act centrally, inhibit the prostaglandin in the brain, the prostaglandin in the brain, and they reset the mechanism to the normal. Okay. That's how they will decrease the body temperature, increase the body temperature. That's why they act as an antipyretic. Okay. So in a smaller dose, the salicylates they will act as a analgesic antipyretic. Now in a higher doses, salicylate inhibit the synthesis of inhibit the in the large doses, salicylate act as an anti-inflammatory. In a small doses, they will act as a antibiotic and analgesic. In the higher doses, they will act as an anti-inflammatory. Salicylates and paracetamol inhibit the prostaglandin synthesis in the brain. Respiration के ऊपर क्या है वो important है ये respiration वाला point. Now salicylates they are known as a weakly acidic drug. So ये क्या करते हैं? They stimulate the respiration. Salicylates stimulate the respiration by two ways. First, by direct stimulation of medullary center. Medulla oblongata में जो आपका respiratory center होता है उसको stimulate करेगा. So respiration salicylates have dual action on the respiration. First, it will stimulate the medullary center directly. Second, it increases the oxygen consumption by muscle. आपके मसल में ऑक्सीजन कंजम्पशन का इंक्रीज करेगा. So your muscle will increase the oxygen consumption. So what will happen? There is a more production of carbon dioxide. आपके मसल में ऑक्सीजन का ज्यादा यूटिलाइज होगा, मतलब मसल में मेटाबॉलिक एक्टिविटी बढ़ जाएगा. So if there is increased oxygen consumption, there is a increased production of carbon dioxide. And increase the production of carbon dioxide that is released in the blood. So if there is increased the production of carbon dioxide in the blood, so carbon dioxide is itself is a potent stimulator for the respiration. Carbon dioxide बढ़ गया तो और ज़्यादा respiration बढ़ता है. Right? So aspirin directly stimulates the medullary center for respiration, as well as by increasing the oxygen consumption in the skeletal muscle, it increases the production of carbon dioxide. And the carbon dioxide again stimulates the respiration. Right? So ultimately respiration is increased. Now due to that flushing of the carbon dioxide, what will happen? So it results in the respiratory alkalosis. Respiratory alkalosis करेगा. Aspirin causes the respiratory alkalosis. Okay? Now if there is a respiratory alkalosis, means there is a increased carbon dioxide in the your blood. So increased carbon dioxide will be removed from the body via kidney in the form of bicarbonate. Bicarbonate का सिंथेसिस बढ़ेगा इसमें किडनी में, bicarbonate वहाँ से निकल जाएगा. So during the removal of that bicarbonate, what happens? Sodium and other water and sodium, they are also removed. Okay. So on one hand, it increases the production of CO2, causes the respiratory alkalosis, and to counteract that respiratory alkalosis, your body will remove the carbon dioxide in the form of bicarbonate, and that leads to metabolic acidosis. ये दो काम करता है. एक तो रेस्पिरेटरी अल्कोलोसिस करता है, मतलब ब्लड का पीएच बढ़ेगा, रेस्पिरेशन बढ़ेगा, पीएच बढ़ेगा. और मेटाबॉलिक एसिडोसिस करता है. मेटाबॉलिक एसिडोसिस मतलब कि मेटाबॉलिज्म है उसमें एसिडोसिस, उसमें इट विल इंक्रीज द प्रोडक्शन ऑफ एसिड्स लाइक लैक्टिक एसिड, पायरुविक एसिड. सो इट हैज अ ड्यूअल एक्शन. इट कॉजेस द रेस्पिरेटरी अल्कोलोसिस, इट कॉजेस द मेटाबॉलिक एसिडोसिस. आर यू गेटिंग और नॉट? समझ रहा है आपको? Okay, so what is the action of aspirin on acid-base balance and electrolyte? It causes the respiratory alkalosis, the production of that is done by therapeutic dose of your salicylate. It produces the respiratory alkalosis and metabolic acidosis. So it's countered by your body by excretion of alkaline urine containing bicarbonate along with the potassium and sodium. So it causes the severe disturbance in the electrolyte. तो ये क्या करता है कि because of the production increase in the utilization of oxygen by the muscles, ये क्या करेगा? कार्बन डाइऑक्साइड का प्रोडक्शन बढ़ाएगा. because of that increased carbon dioxide production, so respiratory alkalosis होगा. respiratory alkalosis. To counteract that respiratory alkalosis, your body will try to remove that carbon dioxide from the either your breath, okay, or by also by kidney. So in the kidney, the carbon dioxide is converted to bicarbonate ion, and that bicarbonate ion is removed. Okay. So during the removal of bicarbonate through kidney, so sodium and potassium is also lost. That's why electrolyte imbalance. And this stage is termed as a compensatory respiratory alkalosis. Respiratory alkalosis के लिए compensate करने के लिए ये क्या कर रहा है? Bicarbonate remove कर रहा है. उसके साथ में सोडियम जा रहा है, पोटेशियम जा रहा है. And it also produces the metabolic acidosis. Important है ये, कभी कभी क्वेश्चन में आपको घूम करके आएगा. What is the action on GID? It causes the dyspepsia. Okay? Dyspepsia means decrease the production of pepsin. Okay. Now what is the what is this aspirin? Aspirin क्या होता है? It is nothing but the weak acidic drug. It is a weakly acidic drug, right? So as it is a weakly acidic drug, aspirin or salicylate. So particularly salicylate. Yeah. So they will remain unionized in the stomach. Stomach पे जाता है acidic. So as salicylate will remain unionized in the stomach, and they will get adhered to the GIT wall, and they causes the irritation in the stomach. Okay. So gastric irritation is the adverse effect again. Again nausea, vomiting, they are the adverse effect. Upon long term use, they may produce ulcer, not acute use, but upon long term use. Dyspepsia, nausea, vomiting as a result of gastric irritation, peptic ulceration, and GIT bleeding due to GIT bleeding. They produce ulcer because of the two reasons. ये aspirin ulcer कैसे करता है? Because of the two reasons. First reason क्या होगा आपका? As it is a irritant to your GIT. GIT के लिए irritant होता है. GIT के irritant. That is the first reason. Second reason, it inhibits the COX. COX inhibition in the inflammation tissue, it is a beneficial, but inhibition of COX in the GIT, that is a pathology. In the GIT, prostaglandin is important. It has a negative role in the acid formation. It has a protective role in the stomach. Due to inhibition of COX in the stomach by aspirin, that also leads to ulceration. So it causes the ulcer because of two reasons. First, gastric irritation. Second, inhibition of COX. Right? Yes or no? Then also causes the GIT bleeding due to its chemical nature of weak acid and COX inhibition. So this is the dual one. Now, anti-inflammatory activity is because of the inhibition of prostaglandins in the peripheral tissues. Then that leads to decreased production of PG, prostaglandins, and decreased reduction. Okay, that leads to reduction in the capillary permeability, reduction in the edema, inhibition of neutrophil aggregation and activation. So जहाँ पे neutrophil का aggregation होता है ना, that is chemotaxis. So this aspirin inhibits the chemotaxis, the movement of neutrophils towards the inflammation. Chemotaxis के ऊपर क्वेश्चन आ चुका है. What is chemotaxis? Movement of neutrophil towards the infection or towards the inflammation. Movement of neutrophil towards the inflammation or infection known as a chemotaxis. So aspirin inhibits the chemotaxis. That's why it acts as an anti. Okay. So it means the movement of your neutrophils towards the inflammation or towards the inflammation known as a chemotaxis. Movement of neutrophil. क्वेश्चन इसके ऊपर आ चुका है, इतना सिंपल. So what is chemotaxis? So movement of किसका movement? न्यूट्रोफिल्स का. कहाँ पे? In the inflamed tissue or in the infection, side of infection. Chemotaxis. No, that's how it acts as an anti-inflammatory. Next क्या है? What is the effect of this salicylates on the blood platelets or hematopoietic system? So aspirin inhibit the platelet aggregation. Aspirin क्या करता है? Platelet aggregation inhibit करता है by inhibiting the COX in the platelet. It is an irreversible inhibitor of COX. It acetylate the COX enzyme. ये क्या acetylation करता है COX enzyme का, and it inhibit the COX irreversibly in the platelet in the lower doses like 75 to 150 milligram, or you can say 50 to 150 milligram. 75 it is the correct dose. 75 to 150 milligram. But you can say at a lower dose 50, or you can say 40 to 150 or 50 to 150. So it inhibits the platelet aggregation and it acts as an anti-platelet drug, prevent the formation of thrombus. So aspirin, okay, so it is an anti-platelet drug. In the platelets or thrombocytes, it is also known as thrombocytes. Okay, so as these thrombocytes, they will not have nucleus. Thrombocytes में क्या है? Nucleus नहीं होता है. Okay, thrombocytes में क्या होता है? Nucleus नहीं होता है. So as there is no nucleus in the thrombocytes, these aspirin inhibit the COX in the thrombocytes, and that's why that thrombocyte will become useless, because उसमें nucleus नहीं तो वो COX फिर से नहीं बनाता. Okay? So as thrombocytes or platelet does not have nucleus, it will not regenerate the cyclooxygenase because it is inhibited by it is inhibited by aspirin. Right? Now, two, okay, so that's why aspirin exerts its anti-platelet effect for 3 to 5 days. Now, after 3 5 days, what happens? New thrombocytes will be replaced. Well, that's why aspirin will inhibit the platelet aggregation for 4 5 days. Now, 75 to 150 milligram daily aspirin completely suppresses the synthesis of aspirin, synthesis of thromboxane A2 for 7 to 10 days. And this dose 75 to 150 milligram. This dose is used. Aspirin is used in this dose prevent for the prophylaxis of myocardial infarction or prophylaxis of stroke. So antiplatelet dose कितना है उसका 75 to 150 milligram. So in this dose aspirin is used for the prophylaxis and prophylaxis of myocardial infarction or stroke or post myocardial infarction to prevent the coagulation. Okay? याद रखना है. Non-acetylated salicylate such as sodium salicylate does not have any antiplatelet. Methyl salicylate and sodium salicylate, they are not an antiplatelet. Only acetyl salicylic acid is an antiplatelet. याद रखना है. And remember, it is an irreversible inhibitor of COX. Question इसके ऊपर भी आ चुका है. What is the normal dose? What is the dose responsible for the inhibition of platelet 75 to 150 milligram? इसके ऊपर क्वेश्चन बहुत बार आ चुके हैं. लीवर एंड किडनी के ऊपर क्या एक्टिविटी है इसका? So अगर और एक वर्ड, so this acetyl salicylic acid and other salicylate, methyl salicylate, sodium salicylate and methyl salicylate, they are the soluble salicylates. Okay? Soluble salicylate होता है, and this aspirin is a relatively insoluble. That's why aspirin has a more potential to cause gastric irritation. सर मी एक 15-20 मिनिटांनी कॉल केला चालू करण्यात सेशन मध्ये चालेल सर, किंवा मी पण कॉल करतो. And sorry for inconvenience. In the liver and kidney, what is the action? Okay, so acetyl salicylic acid, मतलब aspirin. So it is a what relatively insoluble in nature. That's why it has more potential to cause gastric irritation because it remains in an unionized form in the GIT, and these they are also weak acid drug, but they are soluble in nature. That's why they are less potential. Liver and kidney, it increases the secretion of bile. Okay? Secretion of bile करते हैं, increases the secretion of bile, stimulate the hepatic parenchyma, that is cholerectic action, stoppage of uric acid. Then uricosuric effect, in a small doses 1 to 2 gram per day, salicylate interfere with the urate secretion. Urate मतलब uric acid secretion in the distal tubule. Okay? But increases the, and that's why increases the plasma urate level, uric acid का level बढ़ देगा blood में. In the larger doses 5 gram per day. Okay. However, it inhibits the reabsorption of urate from proximal tubule and causes uricosuric. The small dose may 1 to 2 gram per day. So they increase the uric acid level. Means they prevent the excretion of uric acid. The small dose. But in the larger doses, they inhibit the reabsorption of uric acid. That means they cause the uricosuric, excretion of uric acid. Smaller dose में क्या करता है, यूरिक एसिड का एक्सक्रीशन नहीं होने देता, तो यूरिक एसिड बढ़ाता है बॉडी का. लार्जर डोज में क्या करता है, यूरिक एसिड को रिमूव करता है. इज दैट क्लियर? यस और नो? नाउ ADME मतलब क्या? एब्सॉर्प्शन, डिस्ट्रीब्यूशन, मेटाबॉलिज्म, एलिमिनेशन. So salicylates, they are well absorbed from the stomach as they are a weakly acidic drug. They remain unionized in the stomach pH. Largely they are absorbed from stomach and upper intestine. Okay? When they are given early. So 80% of salicylate they binds to plasma protein. 50% aspirin bind to plasma protein, and that's why there might be chances of drug interaction, protein binding interaction. So they are incompatible with the aspirin. Aspirin is incompatible with the warfarin and other drugs because they will displace the warfarin binding site. They show dose dependent kinetics. In the smaller dose, they will follow first order reaction, and in the larger dose, they will follow zero order kinetics. Diaflunisal, उसका एक derivative होता है. It is a non-acetylated diafluorinated salicylic acid derivative. It has a higher analgesic and anti-inflammatory activity. आप बोले ये रेड में क्यों क्या है? पहले आप स्पेलिंग मिस्टेक था, करेक्ट करके स्पेलिंग मिस्टेक करेक्ट किया है. बुक में डायफ्लोनेसा, डायफ्लो मतलब दो, फ्लो मतलब फ्लोरीन. The adverse effect of aspirin, adverse effect. So first intolerance, intolerance. These are nothing but the common skin rash you trigger या pruritus. जो आपके स्किन के ऊपर रैश हो जाएगा, pruritus हो जाएगा. Angiorectic edema, bronchospasm, anaphylaxis, like shock and thrombocytopenia, increasing the number of abnormal thrombocytes. These are the adverse. Now, anaphylactic reactions in the anaphylactic reaction in the patient who are deficient in the glucose 6 phosphate dehydrogenase deficiency. Okay. And next होता है आपका what is the adverse effect of aspirin on the GIT? Dyspepsia, nausea, vomiting, heartburn, ulceration are the common side effects. Chronic administration of aspirin can result in the gastric bleeding. बाद में hematopoietic stain, ब्लड के ऊपर क्या करेगा? It can decrease the prothrombin level by interfering the action of vitamin K in the liver. तीसरा एक होता है रेज सिंड्रोम, GPAT 2018 में क्वेश्चन आता है रेज सिंड्रोम. इसके ऊपर GPAT 2018 में क्वेश्चन आ चुका है. एडवर्स इफेक्ट ऑफ एस्पिरिन, ये एस्पिरिन का एडवर्स इफेक्ट होता है. रेज सिंड्रोम याद रखना है, रेज सिंड्रोम. व्हाट इज दैट? What is the use of aspirin? It is an analgesic, antipyretic and anti-inflammatory drug. So it is used as an antipyretic. Okay? So when you got an infection, जो बच्चे होते हैं below 12 year of age. So if the children below 12 year of age, they are suffering from infection of influenza and varicella zoster. Varicella zoster मतलब क्या? कान है, मतलब वही आपका चिकन पॉक्स. Varicella zoster causes chickenpox, and if children below 12 year of age they are suffering from varicella zoster, and if you give aspirin in that patient to decrease the body temperature, what will happen? There is a development of Ray's syndrome. Ray's syndrome reaction. So what happens in this? So hepatic encephalopathy. Hepatic encephalopathy. Hepatic encephalopathy will develop. Now, hepatic encephalopathy means what? So your liver is not able to remove the toxins from body. So your liver will not able to remove toxins from body, and the toxin get accumulated in body, and that act on a brain. That result in nausea, vomiting, okay, then decreased mental activity, vertigo, dizziness. So that is known as the Ray's syndrome. Serious and fatal complication occurs after few days after viral infection, especially influenza and varicella in the children below 12 years of age. Liver dysfunction करेगा due to hepatic mitochondrial injury, consequent metabolic encephalopathy. Aspirin is contraindicated in case of infants, children under 12 years of age. Again, in the pregnant woman and infants. So aspirin क्या करता है? In the pregnant woman, it may delay the onset of labor. It may delay the onset of labor. मतलब आपको डेट दी है डॉक्टर ने कि आपकी डिलीवरी कल होगी, है ना, कल 12 बजे तक होगी. अगर एस्पिरिन आपने ले लिया तो इट मे डिले द ऑनसेट ऑफ लेबर. व्हाई? क्यों करता है? क्या होगा इसका रीजन? एनीबडी? क्या हो सकता है रीजन? एनीबडी? यस, एनीबडी? आप पढ़ते नहीं हो, कुछ पढ़ना चाहिए, आप पढ़ते नहीं हो, इसलिए मुझे बोलना होगा, मेरा काम ही है. यस, एनीबडी? इट मे डिले द ऑनसेट ऑफ लेबर. लेबर डिलीवरी होने के लिए डिले करता है. कौन? एस्पिरिन. इट इज यूज्ड इन द प्रेग्नेंट वुमन. क्यों करेगा? रिमेंबर. ओके, सो देयर इज अ रोल ऑफ प्रोस्टाग्लैंडिन ओवर देयर in the uterus. So prostaglandins in the uterus, what is the role? It will cause ripening of your cervix, ripening of cervix and loosening of cervical cervix muscle. Okay, so and it will induce the contraction in the urine, right? And you know that aspirin is nothing but the aspirin inhibits the COX and decreases the production of PG, decreases the production of prostaglandin. So If there is no prostate lining, how there is ripening of your cervix muscle, and how there is a contraction of labor, how there is a contraction of uterus, there will be no labor pain, right? That's why in the pregnant woman, aspirin decreases the onset of labor. It may cause greater blood loss during the delivery because it is an antiplatelet reaction. ये blood loss भी ज़्यादा करता है. That's why aspirin is contraindicated in case of pregnancy. Again, it may another aspirin is also क्या बोलते हैं उसको, it is also teratogenic in nature. आप बोलेंगे सब कैसे? Aspirin is also teratogenic in nature. Aspirin is also teratogenic in nature. So aspirin क्या करता है? So aspirin will prematurely, okay, aspirin and indomethacin, they are the teratogenic in nature. Teratogenicity. So they can cause premature closure of ductus. Anybody know what is meant by ductus arteriosus? बोला है मैंने, I think इसको वीडियो में बोला था मैंने. Anybody knows what is meant by ductus arteriosus? Anybody knows what is meant by premature ductus? Sorry, what is meant by ductus arteriosus? Ductus arteriosus. अगर मालूम नहीं तो आपको बोलता हूँ, ठीक है? नहीं है तो बोलो, मालूम नहीं सर, मैं बोलूँगा. Otherwise मुझे कैसे मालूम होगा? Yes or no? नहीं होगा. When there is a child in the womb of mother, माँ के पेट में जब बच्चा होता है, मान लीजिए अभी मैं ड्राइंग तो नहीं कर सकता, लेकिन मान लीजिए एक बच्चा है माँ के पेट में. So when that child is in a womb of mother, so that child is present in the amniotic fluid in the womb. amniotic fluid में होता है. तो वो सांस कैसे देख सकता है? So he cannot breathe. वहाँ पे वो breathing नहीं होता. So he will get all the necessary nutrient oxygen from mother's blood. मदर का blood जो होता है, that will provide the oxygen nutrition to that child. Okay. So during when that child is in a womb, he cannot take a breath. There is no respiration. So oxygen is supplied by mother's blood. Now after the oxygen is supplied by mother's blood. Okay. Now whenever that child is in the womb, वहाँ पे उसका जो हार्ट होता है, child, in the heart of child, so right, okay, so left atrium जो होता है, यहाँ पे जो left atrium लिखा है, ये left atrium, ये right atrium. Heart has 4 chambers. This is the right atrium, this is the left, this is the right ventricle, this is left atrium. Now this child is in a womb. What happens? So right left atrium of this child, it has some small hole or some artery. Okay, that artery is connected with the mother's blood. So mother will provide oxygenated blood to the left atrium of that child. लेफ्ट एट्रियम में मदर से ऑक्सीजनेटेड ब्लड आता है, क्योंकि वो तो सांस नहीं ले सकता. ऑक्सीजनेशन कहाँ पे होता है ब्लड का? जब आप सांस लेते हो तो लंग्स में होता है. तो ये तो अंदर है एमनियोटिक फ्लूइड में, सांस कैसे लेगा? सांस लिए तो मर जाएगा वो वहाँ पे, क्योंकि अंदर जाएगा एमनियोटिक फ्लूइड, होगा उसका लंग्स चोकअप, मर जाएगा. So at that time there is a small artery is there which supplies the oxygenated blood to the left atrium of fetus. Now, soon after the birth होने के बाद में क्या होता है? Soon after the birth, so that artery should be closed. That small artery should be closed. Now what happens? Sometimes few babies, they are not able to close that, or in few babies there is no closure of this ductus arteriosus. इसको बोलते हैं ductus arteriosus. So it is a small artery which is supplied to a left atrium of your child, which is connected with the mother's blood. Okay? So that supplies the oxygen to the left side of your baby's heart. Now, soon after the birth, this ductus arteriosus, this opening should be closed. The opening क्या होना चाहिए? Close होना चाहिए. But sometimes in few children that ductus arteriosus is not closed due to some reason. For example, some drugs also causes that. So that is known as a ductus arteriosus. So it is present in the all fetus. Ductus arteriosus सब में होता है. आप बोलते हैं ना इसके दिल में छेद है. अरे सबके दिल में छेद होता है भाई. हाँ वो छेद सबके दिल में होता है. आप बोलेंगे सब क्या पागल हो इस बात करो. सबके दिल में छेद होता है. बट डिफरेंस ये होता है कि वो छेद जब आप बाहर आते हो ना तो वो क्लोज होना चाहिए ना. वो होता है उसको बोलते हैं डक्टस आर्टरोसिस. यहाँ पे क्या है एक स्मॉल आर्टरी होता है जो लेफ्ट एट्रियम में आपका ब्लड सप्लाई करता है मदर के ब्लड से. दैट इज नोन एज डक्टस आर्टरोसिस. So soon after the birth that should be closed. If it is open that is dangerous. That should be closed. Because जब बच्चा पेट में होता है तो वो सांस कहाँ से लेगा. उसको सांस नहीं लेगा तो वो 9 महीने जिंदा तो रहना चाहिए. उसको ऑक्सीजनेटेड ब्लड को आता है मदर से. थ्रू ए डक्टस आर्टरोसिस. Soon after the birth that should be closed. Okay. Now if this aspirin and indomethacin if they are used in the pregnant woman तो ये क्या करता है it causes the premature closure of ductus arteriosus. Premature closure मतलब क्या है डिलीवरी होने के पहले ही ये बंद कर देगा. मतलब पेट में जब है बच्चा तब भी बंद कर देगा ये डक्टस आर्टरोसिस क्लोज. इसको ऑक्सीजन की ब्लड नहीं आएगा. तो द fetus में develop hypoxia. That's why aspirin is a teratogenic in nature. Are you getting or not? ये मालूम था आपको डक्टस आर्टरोसिस का फंडा. ये सब नो मालूम है कि आपको. बहुत सारे लोगों को मालूम नहीं पढ़ते नहीं. ठीक है. बहुत सारे क्लासेस वालों को भी मालूम नहीं. उसके लिए पढ़ना पड़ता है. रट्टा मार के नहीं जाता. डक्टस आर्टरोसिस it is present in the all babies. Okay. So aspirin indomethacin they cause the premature closure of ductus arteriosus. Okay. So that's why sometimes this aspirin indomethacin they are used in the ductus arteriosus. Open duct. Okay. Parenteral ductus arteriosus PDA. Okay. PDA. Okay. So if any baby is delivered and his ductus arteriosus is not closed, so in that condition aspirin and indomethacin they are used. Okay. And if the ductus arteriosus is closed in the womb, अगर अंदर ही close होता है तो that is also again dangerous. So to keep that ductus arteriosus open, so prostaglandins are used. So particularly carbapost. देखो इतना है. Carbapost they are used to open the ductus arteriosus, and this aspirin indomethacin they are used to close the ductus arteriosus. So open बाहर आने के बाद ओपन रहेगा तो प्रॉब्लम है. अंदर क्लोज हो गए तो प्रॉब्लम है. तो अंदर तो ओपन रहना चाहिए क्योंकि अंदर है बच्चा तो सांस नहीं ले सकता. वो वहां से तो ब्लड आता है ऑक्सीजन. बाहर आ गए तो सांस लेता है. अगर वहां पे ओपन हो गया तो ब्लड तरफ भी जाएगा. वो क्लोज होना चाहिए तभी जाके लंग्स के इधर ब्लड जाएगा. जब डिलीवरी होता है बच्चे का तो वो डक्टस आर्टरोसिस क्लोज होना चाहिए तभी जाके लेफ्ट वेंट्रिकल पंप करता है ब्लड है ना. और राइट एट्रियम खींचता है ब्लड. कहाँ से lungs से आएगा प्यूरिफाई होकर. So that's why ductus arteriosus. So remember this aspirin is a contraindicated in case of pregnancy. So it causes the premature closure of ductus arteriosus and result in the serious pulmonary hypertension in the newborn. Next is salicylism. Salicylism means what? So it is a toxicity of salicylic acid. Toxicity of salicylic acid. Mild salicylate intoxication is because of the high dose of salicylate. Now this develops when salicylate level exceeds 25 mg percent in the plasma. Okay. It is characterized by headache, dizziness, vertigo, tinnitus, difficulty in the hearing, diminution of vision, drowsiness, lethargy, mental confusion, vomiting, diarrhea. That leads to salicylism. So acute overdose of salicylic acid leads to salicylism. Salicylism. Okay. Chronic dose or higher dose of salicylate leads to poisoning. Okay. So acute salicylate intoxication. Okay. Acute salicylate intoxication. ज़्यादा डोज हो गए तो टॉक्सिक हो जाएगा. Okay. 10 to 15 gram. Remember, 10 to 15 gram of salicylate. 10 to 15 gram of aspirin is a toxic in nature. So characteristic features includes acid base and electrolyte disturbances, hyperglycemia, dehydration, hyperpyrexia, blood temperature बढ़ जाएगा, gastric irritation, occasionally hemorrhage in the GIT. If you get salicylic acid toxicity, salicylic acid का toxicity अगर हो गया है, so what is the precaution? First you have to do gastric lavage. Gastric lavage मतलब क्या है? पेट साफ करना. कैसे से साफ करेंगे पेट? By using bicarbonate ions and by using activated charcoal. Gastric lavage, पेट साफ करना. Correction of hyperthermia, जो बॉडी टेम्परेचर बढ़ गया है उसको कम करना. डिहाइड्रेशन करेक्शन. elimination of aspirin by alkalization of urine. सोडियम बाइकार्बोनेट फ्लो सल्फ्यूरिक एसिड का रिमूव हो जाएगा, वो यहाँ ऑलरेडी से. अल्कलाइजेशन इन पेरिटोनियल डायलिसिस. विटामिन के देना है क्योंकि एस्पिरिन क्या है? एंटीप्लेटलेट है, ब्लीडिंग को बढ़ा देगा. विटामिन के क्या है? कोएगुलेंट है. देन you can also increase the removal of this salicylate by using forced diuresis. Forced diuresis ज़्यादा diuresis करना है. So in that condition you are going to use furosemide. Furosemide you have to use in case of acute salicylate intoxication. And sometimes you can say furosemide is an antidote for this salicylate. लेकिन वो ऐसा होता नहीं. So there is no specific antidote for salicylate poisoning, but you can say furosemide. It look dirty. Then sodium bicarbonate is also used to to increase the removal of this salicylate. Therapeutic uses of salicylate. Use क्या रहेगा? First, so it is used locally as a keratolytic to remove the keratin. It is a fungistatic and mild antiseptic counter-irritant. Analgesic and antipyretic. So it is used as an analgesic in the arthralgia मतलब bone pain, myalgia मतलब muscle pain, neuralgia मतलब nerve pain, toothache मतलब दांत का पेन, headache मतलब सर का पेन, back मतलब का body का back pain, dysmenorrhea. Use anti-inflammatory. It is also used in the anti-inflammatory in the arthritis and fibromyositis. Fibrous muscle का inflammation हो गया, fibromyositis. Arthritis मतलब bone का inflammation. Anti-rheumatic. So rheumatoid arthritis में it is used to relieve the pain and inflammation in the rheumatic fever. Reduction of joint swelling is there. Okay. Antiplatelet action to prevent the formation of platelet and fibrin thrombus. The patient with the ischemic heart disease. So for aspirin is used prophylactically. Aspirin is used prophylaxis for the prophylaxis. यहाँ पे और एक मैं बोलता हूँ आपको. So if somebody is having heart attack in front of you, आपके सामने किसी को हार्ट अटैक आ चुका है, तो इमीडिएटली क्या करना है? एस्पिरिन का एक टैबलेट लेना है, उसको पाउडर करके उसके मुंह में डालना है या फिर उसके मुंह में रख देना है. क्या होगा इससे? इट विल एक्सर्ट एंटीप्लेटलेट इफेक्ट एंड द चांसेस ऑफ दैट पेशेंट सर्वाइवल चांसेस ऑफ दैट पेशेंट विल इंक्रीज. पेशेंट का सर्वाइवल चांसेस बढ़ जाता है. So you cannot use directly the drugs. That's why aspirin is very safe. That's why aspirin is used for prophylaxis, means prevention of myocardial infarction, okay, or stroke. Stroke के लिए भी. Miscellaneous use क्या है? It is used in the treatment of Bartter syndrome. Bartter syndrome. Niacin induced flushing. Vitamin niacin जो होता है निकोटिनिक एसिड, vitamin B6, and vitamin B5. So niacin. So it causes the creatinous vasodilation and increased body temperature. So it is used in the niacin flushing. So comparison between aspirin, okay, different salicylic acid derivatives. Okay, comparison between different salicylic acid. So aspirin, it is used in dose of 300-350 milligram tablet. So you know that ASA is the tablet. ASA नाम का tablet होता है. आसाबक नाम को होता है. Disprin नाम को होता है आपको. Aspirin plus calcium carbonate. Analgesic in a dose of 300 to 600 milligram. Anti-inflammatory in a higher dose, that is 4 to 6. Antiplatelet action के लिए कम डोज आता है 75 to 300 milligram. Sodium salicylate that is also available in 325 650 gram. Salicylic acid 2% ointment होता है उसका. 2% ointment salicylic acid का होता है. It is known as a white field ointment. इसका composition के बारे में पूछा है एक बार क्वेश्चन GPAT. White field ointment, I think GPAT 2023 में आया. White field ointment consists of salicylic acid 3% and benzoic acid 6%. It is used topically as a fungistatic agent. Then methyl salicylate is present in the oil of wintergreen. So again used as a counter-irritant. Diflunisal. So it is a analgesic anti-inflammatory. It is a comparison of next आता है आपको paracetamol फटाफट लेंगे अभी so paracetamol it is a para-aminophenol derivative okay so phenacetin was the first drug it was developed but it is no more used it is banned because of the adverse effect now phenacetin after metabolism is converted to paracetamol you can say paracetamol is the active metabolite of phenacetin phenacetin is a prodrug of paracetamol then benzoyl is also there benzoyl is a prodrug of paracetamol as well as aspirin. It has a weak action on prostaglandin synthesis, that's COX. So in the inflammatory tissue, it has a weak anti-inflammatory. Mostly it's an analgesic and antibiotic. So in the inflammation, what happens? There is an increased concentration of parasite. Parasites inactivate the paracetamol, and that's why paracetamol has a weak anti-inflammatory activity. So ineffective in presence of it. However, it equally blocks the blocking the enzyme of COX in the brain. So it is a selective COX-3 inhibitor in the brain. इसके ऊपर दो बार क्वेश्चन आया. What is the mechanism of paracetamol? It is a selective COX-3 inhibitor in the brain. DI के एग्जाम में भी आ चुका है, GPAT में भी आ चुका है. So responsible for the antipyretic effect. Selective inhibition of COX-3 in the brain by paracetamol responsible for its antipyretic effect. It is the temperature. Therefore, paracetamol is a potent antipyretic analgesic as compared to aspirin in the therapeutic doses, but devoid of significant anti-inflammatory effect. It is a routine drug for antipyretic and analgesic activity. So, paracetamol is a de-ethylated active metabolite of phenacetin. Adverse effect क्या है इसके? It is a much safe drug than aspirin. It will not irritate your GIT in the therapeutic doses. इसका GIT irritation कम होता है इसका. Okay. And again, absorption, distribution, metabolism, elimination. ये is more adequately absorbed from the GIT. Adverse effect क्या होते हैं इसके? Hepatic and renal toxicity. Most of the NSAID जो है उनको nephrotoxicity as adverse effect है. All NSAID has a potential nephrotoxicity. ठीक है आपने देखा भी होगा ज़्यादा पेन किलर खाओगे तो क्या होगा किडनी डैमेज होगी बोलते हैं ना अपन क्यों मोस्ट ऑफ द anti-inflammatory drugs has a renal toxicity. So hepatic and renal toxicity is there. A large dose of paracetamol beyond the 6 gram per day. Okay, large dose of paracetamol beyond the 6 gram per day. 7 to 10 gram दिया है यहाँ पे. Okay, 7 to 10 gram beyond the 6 gram per day. 6 gram के आगे. Okay, 7 to 10 gram of paracetamol produces the extensive hepatic damage. Okay, renal tubular necrosis. So 7 to 10 gram जो paracetamol है more than 6 gram that is hypertoxic not normal dose. आप बोलेंगे सर paracetamol क्या है hypertoxic है तो कल से लेना बंद. It is not hypertoxic in therapeutic doses. It is a hypertoxicity is there when you take paracetamol beyond 6 gram per day. Question आ चुका है इसको. It is hypertoxic and general toxic. So it produces the anemia as well as a result of hemolysis in individual with the glucose 6-phosphate dehydrogenase deficiency. Rarely, यहाँ पे rarely it is rarely produces. Now liver toxicity, why it is liver toxic? इसके ऊपर 2-3 बार क्वेश्चन आ चुका है previously गेट में GPAT. Liver toxicity occurs when large dose of paracetamol is taken. Liver toxicity occurs when large dose of paracetamol is taken. That is so it is toxic due to its metabolite. There is a generation of toxic metabolite. Name of metabolite याद रखो क्वेश्चन इसके ऊपर 2 बार आ चुका है. N-acetyl para amino benzoquinone imine. N-acetyl para amino benzoquinone imine. N-acetyl para amino benzoquinone imine. NBQI. This is a toxic metabolite of paracetamol which is generated if you take paracetamol beyond 6 gram per day, and this metabolite react with the hepatic cell, causes hepatic damage, and that is liver toxicity. Okay, but when if you take paracetamol beyond 6 gram per day. Now, how it is metabolized or how it is removed? Normally, also paracetamol is removed, or normally also this metabolite is generated. But what is the normal therapeutic dose? 500 milligram और 1 ग्राम पर डे। अब 1 ग्राम या 500 milligram per day dose लेते हो paracetamol once a day or twice a day. Okay? So in that amount, this N-acetyl para aminobenzoquinone imine is also generated, but it is generated in a very less amount. बहुत ही कम मात्रा में जनरेट होता है कब थेरापेटिक डोज लेंगे तब, बट अगर टॉक्सिक डोज अगर लेंगे तो ज़्यादा जनरेट होगा. Now, this paracetamol is removed or it is metabolized. Okay, remember this paracetamol is metabolized. Okay, it is metabolized by two reactions. It is metabolized by two reactions. This paracetamol is metabolized by two reactions. First is nothing but the glucouronide conjugation, and second one is nothing but the glutathione conjugation. So more than 60% of paracetamol is removed by glucouronide conjugation, and remaining 40% is removed by glutathione conjugation. Remember, glutathione conjugation is also known as a phase 3 metabolic reaction. मेटाबॉलिज्म के इतने रिएक्शन होते हैं, फेज 1 फेज 2 है ना, आपको दो ही मालूम है, फेज 1 फेज 2. फेज 1 में आता है ऑक्सीडेशन रिडक्शन हाइड्रोलिसिस है ना, आपको मालूम है फेज 1 में क्या है, ऑक्सीडेशन रिडक्शन हाइड्रोलिसिस. मोस्ट कॉमन ऑक्सीजन होता है, ऑक्सीडेशन होता है, ऑक्सीडेशन रिडक्शन एंड हाइड्रोलिसिस. ठीक है, ऑक्सीडेशन रिडक्शन हाइड्रोलिसिस एंड सैचुरेशन. सैचुरेशन भी होता है, सैचुरेशन. व्हाट इज द एम ऑफ फेज 1 रिएक्शन? टू impart the to add the that polar groups to the molecule. That is the aim. फेज सेकंड में क्या आता है, ग्लूकोइनोइड कॉन्जुगेशन, ग्लाइसिन कॉन्जुगेशन, सल्फेट कॉन्जुगेशन, अमाइनो एसिड कॉन्जुगेशन, उसके बाद में ग्लूटाथाइन कॉन्जुगेशन, एस्टाइलेशन. तो paracetamol is removed by 60% by glucouronide conjugation, remaining 40% by glutathione. So particularly this metabolite N-acetyl para aminobenzoquinone imine, NBQI, that is removed from the body by glutathione conjugation. Why? Because this metabolite N-acetyl para aminobenzoquinone imine, it reacts with the proteins and amino acids and cells of your liver, those containing the ESH group, sulfhydryl group. उसके साथ में कंबाइन होता है ये नेस्टिल पैरा अमाइनोबेंजोक्विनोन. तो आपके लीवर में जो सेल है, आपके लीवर में जो एंजाइम्स है, आपके लीवर में जो प्रोटीन है, इसमें सल्फाइड्रिल अमाइनो एसिड कंटेनिंग ग्रुप है, ESH ग्रुप. तो उसके साथ में ये क्या करता है, कंबाइन होता है एंड लिवर टॉक्सिक करता है. दैट्स व्हाई अगर ये करता है तो उसका एंटीडोट होता है ये नेस्टिलिसिटी, दैट विल प्रोवाइड अ सल्फाइड्रिल ग्रुप. ये NBQI उसको अटैच होगा और ये रिमूव किया जाएगा ग्लूटाथाइन कॉन्जुगेशन. एंड आल्सो सल्फाइड्रिल ग्रुप इज इंपॉर्टेंट फॉर सिंथेसिस ऑफ ग्लूटाथाइन. So normally metabolite is detoxified by conjugation with the glutathione, but due to higher doses, capacity of glutathione conjugation is saturated. Okay, and that's why remaining up. Okay, तो large dose में अगर लेंगे तो ज़्यादा अमाउंट में ये मेटाबोलाइट बनेगा. ठीक है, कुछ अमाउंट में ये मेटाबोलाइट कॉन्जुगेशन से रिमूव किया जाएगा ग्लूटाथाइन, बट जो बचा है वो क्या करेगा, लीवर में जाके तबाही मचाएगा वो फिर. दैट्स व्हाई. तो एंटीडोट क्या है उसका, N-acetylcysteine. N-acetylcysteine is a specific antidote for paracetamol poisoning. It is not there, then methionine, second antidote. Methionine is another second antidote. Most of the बच्चों को ये मालूम है, N-acetylcysteine, ये methionine मालूम है, याद रखना. Are you getting or not? समझ रहा है क्या? Yes or no? Am I getting? Are you getting? Okay, methionine for paracetamol poisoning. याद रखना है paracetamol poisoning का ये मेटाबोलाइट है, ग्लूटाथाइन कॉन्जुगेशन में होता है, ये N-acetylcysteine एंटीडोट है. अगर ये नहीं है तो फिर मिथेनॉल में. नेक्स्ट आता है आपका पायराजोलोन डेरिवेटिव. पायराजोलोन डेरिवेटिव इसमें अमाइनोपायरिन आता है, एंटीपायरिन, फिनाइलब्यूटाजोन, ऑक्सीपेनब्यूटाजोन. ऑक्सीपेनब्यूटाजोन is active metabolite of phenylbutazone. Now other drugs like phenyldimethyl present with the analgesic tablet. Phenylbutazone is the most potent anti-inflammatory drug, but it is rarely used due to side effects, which are that GI gastrointestinal toxicity is there, irritation, ulcer, gastric ulceration, okay, peptic adrenal and hematological toxicity. ये क्या करता है, थ्रोम्बोसाइटोपेनिया करता है, okay, GIT अल्सरेशन करता है, किडनी टॉक्सिसिटी करता है. Oxybenzone is active metabolite of phenylbutazone with the same side effect Analgesic is also potent antibiotic but similar kind of adverse effect. नेक्स्ट आता है आपका इंडोल डेरिवेटिव। इंडोल डेरिवेटिव में आएगा आपका इंडोमिथासिन, इंडोल एसिटिक एसिड डेरिवेटिव। क्वेश्चन आता है ड्रग इज इंडोल एसिटिक एसिड डेरिवेटिव। इंडोमिथासिन, इंडोमिथासिन इज इंडोल एसिटिक एसिड डेरिवेटिव, is anti-inflammatory, antibiotic and analgesic. Okay, it reduces the swollen joint and bring quick reduction in the joint swelling in case of arthritis, particularly useful in the acute attack of gout and arthritis. इंडोमिथासिन। एडवर्स इफेक्ट क्या होते हैं इसका? एडवर्स इफेक्ट ये फ्रंटल लेग जो है कम से कम 3 बार हो चुका। इंडोमिथासिन का एडवर्स इफेक्ट होता है फ्रंटल लेग, सामने वाला सिर का दर्द करेगा। फ्रंटल लेग इज एडवर्स इफेक्ट ऑफ इंडोमिथासिन followed by giddiness, blurring of vision, depression, and psychotic disturbances. It is contraindicated in case of machinery operator. जो डेलिकेट मशीन ऑपरेट करते हैं, जो ड्राइवर्स होते हैं, उसमें ये ड्रग क्या है? कॉन्ट्राइंडिकेटेड। क्यों? इट प्रोसेस द मेंटल कंफ्यूजन, है ना। आप मशीन ऑपरेट कर रहे हो, कई का कटर मशीन ऑपरेट कर रहे हो और आपने इंडोमिथासिन ले लिया, आपको होगा कंफ्यूजन, आपको पता ही नहीं आपको आपका जो आइटम है उसको पकड़ना है या ब्लेड को पकड़ना है। आपने पकड़ लिया ब्लेड को, हाथ कट गया। So it produces the mental confusion. That's why it is not used in the machinery operator and drivers psychiatric patient. ड्राइवर्स में क्यों ना उसका ड्राइवर को दे दिया इंडोमिथासिन, चल रहा है वो गाड़ी, चलने के खेत में गाना सुन के सामने से गाड़ी आ रही, वो हो गया कंफ्यूज, उसको लगा नहीं लेफ्ट साइड में आ रही, उसने जाकर ठोक दिया, वहाँ कंफ्यूजन करेगा। ठीक है। देन अगेन साइकियाट्रिक पेशेंट में, साइको पेशेंट में जैसे बोला है मैंने आपको एग्जांपल भी दिया, जैसे वो क्या करते हैं साइको पेशेंट, दे विल ट्राई टू इंज्योर देमसेल्फ, उसमें और भी ज़्यादा कंफ्यूज होगा, वो मार देगा खुद को। दैट्स व्हाई इट इज नॉट कॉन्ट्राइंडिकेटेड। तो इन द इपिलेप्टिक पेशेंट, किडनी डिसीज पर प्रेग्नेंट वुमन में, चिल्ड्रंस में यूज नहीं करें। इट इज यूज्ड फॉर गाउट एंड अल्कलाइजिंग स्पॉन्डिलाइटिस। अल्कलाइजिंग स्पॉन्डिलाइटिस क्या होता है? तो इट्स अगेन इन्फ्लेमेटरी डिसीज ऑफ अर्थराइटिस। अर्थराइटिस का ही टाइप होता है alkalizing spondylitis. So there is inflammation of your backbone and joints. Sulindac, उसका derivative है. It is a fluorinated derivative of indomethacin. It is a prodrug and has a longer duration of action. Next is nothing but the aryl heterocyclic acid compound.